So on page A17, routes of drug administration. Now, there are four major factors that are taken into account, or should be taken into account, as far as the route by which a drug is given. One of the factors that's taken into account, whether a drug is taken orally, whether a drug is given by injection, whether a drug is taken sublingually, whether a drug is inhaled, is the properties, the chemical properties of a drug. For example, there are some drugs that cannot be swallowed. They won't work if you swallow them. Can you think of any drug that has to be injected, you cannot swallow it? Insulin, absolutely. Do you really think that if somebody had an option, look, you can take this insulin pill or you can inject it twice a day, what would you prefer? Do you really think that any rational person would say, gee, I'd rather inject myself twice a day for the rest of my life rather than swallowing a pill? But it won't work if you swallow it. Because insulin, which is a protein hormone, is digested in your digestive tract just as if you were ingesting any other protein in chicken or any other food. So it's just digested and broken apart into amino acids. So it won't work if you swallow it. Now, what's interesting is that protein hormones are digested in the digestive tract, just like any other protein. But steroid hormones, such as estrogen, can be swallowed. So birth control pills, for example, contain estrogen and progesterone, which are steroid hormones. There are a number of steroid hormones one can swallow. Prednisone is a steroid hormone. So steroid hormones will still work after you swallow them. You might say, well, aren't they digested? The answer is no. We're going to review this more later, but a steroid hormone, does anybody remember steroid hormones are synthesized from what chemical? What chemical is used to manufacture steroid hormones in our cells? Cholesterol. Cholesterol. So cholesterol in your food, and all the cholesterol that might be in your food, that's in eggs, that's in any other food, is absorbed into your body. Frankly, if it was digested, you wouldn't have to worry about eating too much cholesterol because it would just be broken apart. But it's not broken apart. It's absorbed whole. Well, if cholesterol is absorbed whole, then any steroid hormone, which structurally looks like cholesterol, is absorbed whole. So steroid hormones do work when you swallow them. All right, so you have to take into account the chemical properties. Can anybody think of a drug that is commonly taken under the tongue, sublingually?
Nitroglycerin.
Nitroglycerin. But there's only a limited number of drugs that will be dissolved and you can absorb them under your tongue. So they're very limited on which drugs you can take and put them under your tongue. So the chemical properties of the drug are one factor that determines the route that it's given. A second factor is the onset of action. Do you need the effect immediately? Is somebody going into anaphylactic shock where you better give them the medication and it has to have an immediate onset? Or is it okay if it takes 20 or 30 minutes before it starts to work? So if somebody needs an immediate onset, it's going to be injected. If somebody doesn't need the effect immediately, then they can swallow it. But it takes time to swallow and digest and absorb and so on. A third factor is convenience. This becomes kind of a very important factor. The reason why most medicines are taken orally is just the easiest. It's the easiest way to take it. And a fourth factor, which unfortunately is almost never a factor, is the cost. Nobody really usually calculates cost as an issue. But it happens to be that actually drugs that are taken orally, that is one of the least expensive routes. Injections are more expensive. I only mentioned that in terms of health care, the price of health care, usually one of the problems is nobody takes into account costs. So that's why all the costs are so high, because nobody even worries about it until you get the bill. All right, so we divide the routes by which medications are given into two major categories: enteral routes and parenteral routes. Well, we can see the word enteral. If you're wondering what's the word parenteral, it's on the next page, A18, right here, letter C in the middle. All right? So what are enteral routes? What are parenteral routes? Let's start on A17. What is enteral? Enteral, anybody know what enteral or enteric means? Huh? It means intestinal tract. The doctors who deal with stomach and intestine problems are called gastroenterologists. Enteral means the enteric, the alimentary canal, the gut. So enteral routes involve the alimentary canal, the stomach and intestine. So then we further subdivide these, and incidentally, the enteric routes, one of the neat things about the enteric route is you don't need aseptic technique. Because the food that we eat has got lots of bacteria in it. In fact, the whole reason why you secrete hydrochloric acid is to kill bacteria, right? So anything you swallow, it doesn't have to be aseptic. You can swallow anything. So anything you swallow doesn't have to be devoid of bacteria or anything else. We divide the enteric routes into a few subcategories. The first is oral. All right? It's commonly abbreviated PO. It stands for per os. Per os means by mouth. So if you write PO on a prescription, when you're writing out a prescription, PO means by mouth. And in terms of the onset of action, you have to appreciate that when you swallow something, it's going to take about 20, 30 or more minutes before you start to absorb it into your bloodstream and start to get an effect. So if you need an immediate onset of action, you're not going to choose enteral route or oral route. Now, as far as does it have any advantages? Yes, it does. It's the safest route. You'd say, what do you mean? If you gave the wrong drug, if the patient took the wrong drug, if they took too much of the drug, you can induce vomiting and get it out, right? Because it's going to take 30 minutes before it's even really starts to be absorbed. So if you made a mistake, if there's any problem, you can induce vomiting and you can get rid of it. It's also the most convenient. It's real easy to swallow a pill. Thirdly, it's economical. It's inexpensive. And for that reason, these reasons, it's the most commonly used routes. Are there any disadvantages? Yes. There's a slow onset of action, about 30 minutes. So if you've got a really bad headache and you take Tylenol, it may be 20 or 30 minutes before you start to really feel any benefit. Also, some medications cause GI irritation. This is one of the reasons why they don't use aspirin as much as they used to and choose instead Tylenol, acetaminophen, because aspirin is very irritating to the stomach. So are many other medications. Medications that are very irritating to the gut, the alimentary canal, are antibiotics. Has anybody taken the antibiotic erythromycin? Usually it makes people nauseous. Right? That's why they tell you take it with food, right? Because it's just on an empty stomach, it's very irritating, it makes people nauseous. A big problem with the oral route is you never know exactly how much was absorbed. Because if you do take it with food, so you don't get nauseous, the food may interfere with its absorption. If you don't take it with food, you may get nauseous and start to throw it up. So, and even whether you took it with food or without food, we're never exactly sure how much of it was absorbed. You know, when you take certain antibiotics, such as tetracycline, has anybody ever seen where it says do not take with dairy products? Because dairy products, as we will learn, anything containing calcium or other divalent cations interferes with the absorption of certain antibiotics like tetracycline. So again, what's in your gut may interfere with it being absorbed. And a fourth disadvantage is inactivation by the liver. And you might say, well, what do you mean? Okay, let's look on the previous page, A16. And I want to remind you of anatomy on A16. So this is page A16. Let's start here on the left. So you all learned in anatomy that all of the nutrients, everything that's absorbed from the digestive tract, the stomach, the small intestine, the large intestine, is absorbed into the bloodstream, at least water-soluble substances are, and all these blood vessels then bring what was absorbed from the digestive tract into the hepatic portal vein. Remember that? The hepatic portal vein, which transports all this stuff right to the, that was good, the liver. Okay, now, here's the problem with that. First of all, the reason why all the stuff that's absorbed from the digestive tract is carried to the liver is because your liver, the largest organ in your body, is largely involved in storing all these nutrients. It stores sugars as glycogen, it stores amino acids as proteins, it stores vitamins and minerals. It's a big storage depot. But there's a big problem also. You might ask, what's the problem? Which organ of the body is most responsible for metabolizing drugs? Your liver. So the very first organ, when you swallow something and it's absorbed in the digestive tract, the first organ it goes to is the organ that breaks that medicine down. So not only are you not sure how much was absorbed of the drug, you're not sure how much is even going to make it through the liver, and it won't be broken down. So that's something you probably hadn't thought of before. So that's a big problem with taking something orally, is the first organ it goes to is not your heart, not your brain, but to the liver, which starts to break it down. Now, in this diagram on our right, so this shows the digestive tract. This is the mouth and the esophagus, the stomach, the small intestine, the colon or large intestine, the rectum. And here it just indicates that what's absorbed from the stomach, what's absorbed from the small intestine, what's absorbed from the colon or large intestine is carried by the portal circulation, meaning the hepatic portal vein, right to the liver. However, what's absorbed from the mouth and what's absorbed from the rectum is not going to the liver. Only those things absorbed from the stomach and the intestines. So that's why when you take the nitroglycerin and put it under your tongue, it's absorbed directly into the bloodstream, it's absorbed into veins, and the very first organ it goes to is the heart, which is where you want it to act in the case of nitroglycerin. That's why it's a great way to give it, for it to go. It does not go to the liver. Similarly, same thing is true with the rectum. What's absorbed from the rectum, and some of you are thinking, whoa, what do you mean the rectum? Who's absorbing anything from the rectum? These are called suppositories. So there are some medications that are pushed up the butt, and they are absorbed into the rectum, and again, they enter the bloodstream, and they're going to go into a vein and be directly carried to the heart. They do not go to the liver. So only those things absorbed from the stomach and intestine, but not from the mouth or the rectum. Okay, back where we were in A17, so we've mentioned there are some advantages and disadvantages of taking something orally. Now, the dosage forms that are taken orally are called tablets. There's also what are called enteric-coated tablets. These are tablets that have like a hard covering. A hard covering. That's called an enteric coating. And you'd say, well, like, what's that all about? An enterically coated tablet is done that way so that it will not be absorbed in the stomach, but actually won't start to be digested and absorbed until it reaches the intestine. So you'd say, yeah, like, why wouldn't you want it absorbed from the stomach? So an example of an enterically coated tablet is a drug called Ecotrin. Has anybody ever heard of Ecotrin? Anybody? Ecotrin is a registered brand name for an enterically coated aspirin tablet. Now, what have we learned that aspirin does to your stomach? It irritates the stomach. But there's some people who need to take aspirin. You'd say, why? Who needs to take aspirin? Everybody uses Tylenol. Well, some people who have arthritis take high doses of aspirin, which can irritate the stomach. So they take this ecotrin, which is enterically coated. It goes right past the stomach and isn't absorbed into the intestine. So therefore, it doesn't irritate the stomach. Also, what about the people taking the little baby aspirin every day? They're not taking a baby Tylenol, they're taking a baby aspirin because it's an aspirin that has this antiplatelet action. So, but it can cause irritation of the stomach. So then they may take this enterically coated form. And then there's time-release capsules. Have you ever seen the capsules with a whole bunch of little things inside it? And those break down at different rates. So that way you get a longer duration of action. Some of those dissolve rapidly, some of them dissolve more slowly. And so therefore, when you take these time-release capsules, you're absorbing the medication over a long period of time. It's not all absorbed at the same time.
Okay, so if you change the delivery method of a drug to generic, would you be able to register that drug with that delivery method?
Yes, absolutely. So Ecotrin is its own registered brand name. Now, is there possibly now a CVS version after 20 years? Yes. All right. They do give exclusive right for a certain period of time. But yes, you can patent that. You can patent a time-release pill. Okay, they also use these terms elixir, syrups, and emulsions. What's that? An elixir, these are liquids. Like elixir is an alcoholic solution. It's got alcohol in it, sweetened alcohol. That's called an elixir. Then there are syrups, which are sweetened, whether it's sugar or sorbitol. And then there's emulsions, which is an oil-based solution. Now you might ask, well, why? Well, let's start with syrup. Why syrup? Some medicines are so bitter that they need to put sweetening in it if it's a liquid, like for a child to take, because otherwise it's so bitter they wouldn't swallow it. Why an elixir, which is an alcohol-based solution, or an emulsion, which is an oil-based? Because there are some drugs that won't dissolve in water. They will only dissolve in an alcohol base or an oil base. Any fat-soluble drug. Frankly, if you were taking a steroid as a liquid, it would have to be in an oil-based solution because it's all synthesized from cholesterol, which is fat. It won't dissolve in water. These are just things to think about that we usually are not, we hadn't really thought about these problems of just swallowing a pill before. Now, another enteric route is sublingual. It's under the tongue. It's in the alimentary canal. But remember, we've learned that what's absorbed from our mouth goes right into the bloodstream. It does not go through the hepatic portal circulation to the liver. So it is a little bit different than the oral route. The onset of action is minutes, not a half hour like the oral route, but literally minutes. An example of a drug that's taken sublingually is nitroglycerin, and usually, incidentally, what's the problem why somebody takes nitroglycerin? What's their condition? Angina pectoris. So they're getting myocardial ischemia, insufficient oxygenated blood to their heart. So they want to take this drug that is a dilator. It dilates the blood vessels, improves blood flow. So, and the effects are pretty rapid because it's absorbed right into the bloodstream. It causes a kind of a tingling, burning sensation. It causes a warmth right under the tongue. That's because it's dilating the blood vessels under the tongue, and as it dilates it, that increases blood flow. So it causes it to feel warm. So it's literally absorbed very rapidly, and it goes right to the heart, exactly where you want it to work. The advantages is that it's a rapid onset of action. The main disadvantage is that there are very few drugs that can be taken sublingually. It's got it because not very many drugs can dissolve in your saliva, in your mouth. And also, many drugs are so bitter that people wouldn't tolerate putting them in their mouth. Has anybody ever just tasted an aspirin? It's very bitter. If you had to go and just put it under your tongue, you'd spit it out. That's how bitter it is. So you're not going to take aspirin, even if you could put it under your tongue, and you probably could. It's just too bitter to do it. The dosage forms, when you commonly take a medication and absorb it in the mouth or under the tongue, they commonly call that a lozenge or a troche. And to the best of my knowledge, I don't think there's a difference between those two terms. You know, we talk about a lozenge, like a throat lozenge, or a troche, but they refer to the same thing. On A18, everybody's favorite enteric route, the rectal route. Now, the rectal route does take a little bit of time. There are some advantages of taking things rectally. And our first thought is, you got to be kidding. No, I'm not. And listen to what some of the advantages are. You can give it with infants. An infant can't swallow a pill, can they? And they may not even be able to swallow the liquid. All right? Furthermore, this route can be given if somebody's unconscious. If they're unconscious, they can't swallow anything. Is that right? You just put it in their butt. And it can be used for people who are vomiting or nauseous. Whether it's a child or an adult, if you're so nauseous you can't keep it down, you keep throwing it up, then you just put it up the butt. So it does have some real advantages. Now, the major disadvantage is erratic absorption. You have no idea how much is going to be absorbed. Not to get overly graphic, but if you put something up the rectum, and then they have a bowel movement, then they just pushed it back out. So you don't know exactly how much is being absorbed. Now, the dosage form that is given rectally are called suppositories. Suppositories. And these are usually in an oil base, kind of a waxy oil base to make it easier to slide it up the anus into the rectum. Okay, so that takes us to parenteral routes. And parenteral refers to other than the enteric route, other than through the alimentary canal. And in general, the parenteral routes require aseptic technique, because these routes, you have to be careful about introducing bacteria and foreign agents into the body. So this includes IV, intravenous. And of course, as with all these other routes, there are advantages and disadvantages for each one. An advantage of, well, first of all, when you give something right into the bloodstream, boom, it's immediately there, and the onset of action is almost immediately. The advantage is obviously a rapid onset of action. Right? If you needed an effect, if somebody's going into anaphylactic shock, you give an injection, you get that epinephrine, that EpiPen, and in fact, it's actually given sub-Q. But the point is that when you give it and it gets into that bloodstream right away, you get an immediate onset. There's another advantage. You know exactly how much drug is in the bloodstream. We mentioned that when you take a pill and swallow it orally, you never know exactly how much has been absorbed into the body, into the bloodstream. So here we know exactly. If you inject 10 milligrams of a drug into the bloodstream, then there's 10 milligrams of drug in the bloodstream. You know exactly, precisely how much is in the blood. So that's another advantage. A disadvantage, this is the most dangerous route, because you're putting it into the bloodstream. If it's the wrong drug, if it's the wrong dose, you're in big trouble. You can't get it out. It's in the bloodstream. And if it goes into a vein, the first organ it's going to hit will be which organ? The heart. Remember, just try to remember your anatomy. Anything that enters the veins of the body, veins carry blood to the heart. And so that's where it's headed. is it's going right to the heart. So if it's a wrong drug or a drug that's going to really affect the heart, it's going right there first. Okay, so that's intravenous. Intramuscular is another parenteral route. Again, you have to use aseptic technique. This is where a bolus dose of drug is injected into the muscle, and then that drug is absorbed over an extended period of time into the bloodstream. So it's injected into the muscle, it's between the muscle cells, and then the drug is absorbed. Then the drug is absorbed over a number of minutes or hours. So one of the advantages of this route is it provides a reservoir for the drug. It allows you to get this long duration of action as it's absorbed over an extended period of time into the bloodstream. Another advantage is that some drugs are too irritating to give intravenously, but can be given intramuscularly. Having said that, there's also drugs where it's too irritating to give intramuscularly. Probably all of you have received an injection, a shot, a vaccination, whatever it might be, into your shoulder muscle, and it could have really, really hurt and caused pain and tenderness to your muscle for an extended period of time. So that can be a disadvantage. All right. Incidentally, when you're preparing, for a test for this, remember it's all multiple choice. You don't have to memorize every single thing. Just read it over. Does it kind of make sense? So that if I'm asking you some sort of generic question about, let's say, a route of administration, and I give you the choices to choose from, do you think you could choose probably the most logical one, the choice that makes the most sense based on just having thought about this? Okay, subcutaneous, sub-Q. I've changed the onset of action. It had said 30 minutes. It's really more like 10 minutes. It's a pretty rapid onset of action. There are a number of drugs that are given sub-Q, including a TB test, right? Tuberculosis test, a vaccination, like that. Insulin is given sub-Q, usually. And has anybody ever done allergy testing? So that's where they inject the test that, whether they're testing you for fur or for pollen or for dust, they inject it right into under the skin, subcutaneous, right under the skin. Now, this is a disadvantage is that it can be irritating, but one of the most fascinating disadvantages is this is the most allergenic route. And what does that mean? So I want to remind you that in the dermis of your skin, right? I'll remind everybody of your anatomy of the skin. Epidermis is stratified squamous epithelium. Dermis is irregularly arranged, dense, fibrous connective tissue. And in the connective tissue of the dermis, there are a number of cells, including a lot of mast cells. A lot of mast cells in the dermis. And you'll recall that mast cells release histamine and other chemical mediators of inflammation in response to allergens. So, in fact, this is the most allergenic route. That's why they do allergy testing by testing sub-Q, because that triggers the greatest allergic reaction. So we mention this because if somebody is allergic to something and you give it sub-Q, they're really going to show a dramatic allergic reaction when you get given subcutaneously. On page A19, other parenteral routes include intra-arterial, that means into an artery, intra-articular. And an example in terms of dentistry where they give intra-articular, which means into a joint, is, let's say, administering cortisone, or at least a corticosteroid, into the TMJ, the temporomandibular joint. So that would be intra-articular, right into the joint, to reduce inflammation, for example, from a TMJ problem.
What about when someone is getting a bone marrow transplant? Does it not also go into the...
Well, of course, they're not, then they're going into the bone marrow.
Tissue extract.
That's not into the joint. A joint is the space between bones. That's going into the marrow cavity in the middle of the bone.
Oh, there's not like a term for like into the
Oh,
bone?
there's, sure, intramedullary. The medullary cavity is another name for the marrow cavity, medullary. All right, there's terms for everything. Another parenteral route that requires aseptic technique is by inhalation. And inhalation is when you inhale something down into your lungs. Common drugs that you're familiar with that are taken by inhalation include bronchodilators for people who have asthma. I'm sure you know somebody who has asthma who carries with them a bronchodilator. They spray down into their lungs, such as Proventil or Ventolin, albuterol, nitrous oxide. So when nitrous oxide is administered, you inhale it. That's how it's administered. The onset of action is very quick. Now, if you're using a bronchodilator and you inhale it, in fact, in a sense, you're giving the drug topically because you want its effect to be on the bronchioles. And so you're inhaling it and it's going right into the bronchioles. So it's a topical action. When you give nitrous oxide, the action of nitrous oxide isn't on the bronchioles of the lungs. It enters the pulmonary capillaries. It enters the bloodstream. It goes from the lungs, from the alveoli, into the bloodstream. And once it enters the bloodstream, it's distributed everywhere in the body, including being carried up to the brain. So the nitrous oxide side of action is the brain. So bronchodilators acting topically in the lungs. Nitrous oxide is acting systemically, including its action on the brain.
Wouldn't inhalation be considered enteral?
No, because even though your respiratory tract branches off your throat, it is not your digestive tract.
Okay.
If the respiratory system is not really designed, it cannot tolerate a lot of pathogens. That's why we get so many respiratory infections. We said last time, our digestive tract releases all this hydrochloric acid into the stomach, which kills the vast majority of bacteria. Not all of them, but most of them. You don't have a release of hydrochloric acid into the lungs to kill the bacteria. So you don't have that degree of protection that you do with the alimentary canal. Alimentary canal is really your food tube. All right, so the disadvantages, again, is that if in the case of a drug that's being absorbed into the bloodstream, it's going to go from the lungs into the bloodstream, and the first organ it's going to be carried to is the heart. Because I'll just remind you of a pulmonary circulation. The blood goes through the lungs. It's carried from the right pump through the lungs to the left pump. Right? So that means that any drug that's inhaled, it's going to go right to the lungs very quickly. And in fact, before they had the newer bronchodilators, like albuterol, Proventil, they used to give adrenaline to people with asthma. Sometimes they still do. And they inhale it into their lungs. It dilates their airways, which is great. But it also enters the bloodstream, and it's carried right to their heart, and it speeds up their heart. And so anytime that somebody inhales adrenaline into their lungs to dilate their airways, it goes right to their heart, and their heart starts pounding, which is kind of scary to people, especially kids who have asthma, because their heart just pounds. So it does go right to the heart. Now, as far as the dosage forms, they're called aerosol sprays or nebulizers. That's just the terms they use for inhaling these things into the lungs. Also want to mention another route, and that's the transdermal patches. So a transdermal patch is where it's like you stick it onto the skin, and in this patch, kind of like a bandage, a thick bandage, there's the drug is in the bandage, and it's absorbed through the skin into the bloodstream. And we can see a picture of a patch diagrammatically on the previous page, actually on A16. So if you look on A16 on the lower right, this is just showing what's in the patch. This is the patch, this is the skin. And so it's just showing that there's a drug reservoir. So right here is where the drug is in this kind of bandage or patch. And the arrows indicate that the drug is diffusing from this patch, and it's diffusing across the skin into the bloodstream. So the drug is being absorbed over a prolonged duration, a prolonged period of time, is being absorbed into the bloodstream. So that's called a transdermal patch across the skin. So what are examples of medications that are given by transdermal patches? So first off, the obvious advantage is you get a long duration of action. Instead of having somebody having to swallow a pill 2, 3, 4 times a day, they just put this transdermal patch on and they absorb this drug for hours. Now, a disadvantage is that some of these medications can irritate and cause the skin to turn red, so then you can't continue to use the patch. So what are some examples of drugs that are commonly administered with a transdermal patch? So nitroglycerin. Now we've mentioned that nitroglycerin is commonly taken by people who have what problem, what condition? Angina pectoris. That's that pain in their shoulder because of myocardial ischemia. So instead of having to take nitroglycerin, say sublingually every few hours for this pain, they may just put a patch on their skin and absorb nitroglycerin continuously. That's called a transdermal nitro. Estrogen and various hormones can be taken as a patch, so it can be applied that way. Scopolamine is used for motion sickness. So you might be familiar with how some people who suffer motion sickness will put a little patch, commonly by their ear. It doesn't have to be by their ear, but they'll commonly do that to reduce motion sickness. And this drug is being absorbed continuously into their bloodstream for hours.
That was my question. Does the location matter?
No, location does not matter. So, but it's psychological. In other words, if somebody needs nitroglycerin, they might put the patch on their chest over their heart, thinking, that's for my heart. It could be, frankly, on their forehead. It could be on the back of their buttocks. It's being absorbed into the bloodstream. It's not like it goes right through their chest, boom, right to their heart. And same thing with the transderm scot patch for the motion sickness. Doesn't have to be here near your ear, but it's psychological. Well, you know, I get dizzy, so I'm going to put the patch right here close to where I'm getting dizzy. It could be on the chest. It could be on the forehead. It could also be on their butt. Another example is these nicotine patches that people put on to take away their craving for smoking, because they're taking the nicotine, which is what they're addicted to, but at least that way they're not smoking and introducing carcinogenic chemicals in the cigarette smoke. So again, that just delivers the medication over an extended period of time. Any questions on that? Yep.
I have a question going back to subcutaneous.
Yeah.
What would the advantages be aside from just you're not taking it orally? Is there any other really notable advantage?
You get a fairly rapid onset of action. Obviously, if you're doing allergy testing, that's an advantage because you get the strongest allergic reaction. It's safer than intravenous, but then it's still fairly rapid onset of action. So it's faster than taking it orally. But again, we're not going to belabor all these topics.
The nitroglycerin patch, do people only wear that when they're having chest pain, or do they wear it all the time?
It depends how frequently they're experiencing chest pain. If they only get the chest pain once a week, then they'll just take the nitroglycerin under their tongue as needed. PRN, as pro rata, as needed. If they're experiencing this chest pain several times a day, then they're just going to wear a patch. So they absorb that nitroglycerin continuously.
But you'll still build a tolerance to it, wouldn't you, if you wore a patch like?
It depends. We're going to talk about tolerance, or you'll see it covered in one of the videos. Some medications, tolerance does develop, other medications less so. So tolerance doesn't develop in all medications. It does develop in many. So it depends on the medication as far as what tolerance is. Okay, now topical route. So topical, what that means is you put the medication right where you want it to exert its effect. So let me give you an example of what I mean. Look on the next page, on A20. On A20. So examples of topical routes are dermatologic. If you have a rash on your skin and you put the medication right where the rash is, that's called topical. You're putting it topically right at the site where the problem is. If you have, if your eye is irritated, you've got red eye, and you topically put eye drops right into your eye, then the medication is right where the problem is. You're putting it topically right where the problem is. If you've got nasal congestion, you're all congested in your nose and you can't breathe. So you snort the nose drops right up into your nose, so that's topical. You put the medication right where the problem is. If there's a problem in the mouth, somebody has lesions in the buccal area, the inside of the mouth, the oral cavity, and you put something that reduces pain or something else right on the lesion in the mouth, that's topical. If there's a vaginal yeast infection, and one introduces an antifungal drug like Monistat right into the vaginal canal, that's topical. You put the medication topically right where the problem is. So these are examples. I'll come back to this in just a moment. On the bottom of the previous page, so what are the onset of action is right away. Within minutes, you start to get an effect. If you have red eye and you put something that reduces red eye right into the eye, within a matter of moments, it starts to exert its action. The advantage is a local action right where you want it. Disadvantages, I don't know. I think there's really no significant disadvantages. If that's the problem and you put it topically, then that's where you want it. On page A20, what are some examples of drugs that are commonly applied topically? So I've listed antibiotics, antiseptics, anti-inflammatory drugs, a lot of antis there, and local anesthetics. And let's just kind of recall what the difference is between some of these. So I've kind of already given it away as far as the difference between an antibiotic and an antiseptic. You know, an example of an antibiotic would be, let's say that you apply topically, would be misotracin or neosporin, right? Everybody has had some infection on your skin where you put some misotracin or neosporin antibiotic. An example of an antiseptic might be iodine or rubbing alcohol, right? That's an antiseptic. So the question is, what's the difference between an antiseptic and an antibiotic? So I've kind of given it away. The big difference is this. Antiseptics are non-specific. They tend to kill everything, antiseptics. Whereas antibiotics are selective. They are specific or selective. We can choose the antibiotic that is effective against gram-positive aerobic cocci, or we could choose a different antibiotic that's effective against anaerobic gram-negative bacilli, right? So they can be very specific. And because of the fact that antiseptics are not specific, selective, and antibiotics are, that's why in general you cannot take antiseptics internally. You don't drink, if you've got an infection, you don't drink rubbing alcohol. Why not? Because the rubbing alcohol will kill bacteria, but it's also going to kill you. So you don't take it if you have chlorhexidine, right? You don't drink a bottle of chlorhexidine. Gargle it and spit it out and so on. So, because these things can be toxic to you. They can kill your cells. That's why alcohol, when you put it on a sore, a wound, it burns, it hurts. It's literally killing your cells just like it's killing the bad guys, the bacteria. On the other hand, antibiotics in general can be taken internally because they are specific, they are selective. They kill bacterial cells while having very little harmful harm on your own cells because they specifically act. In the case of penicillin, penicillin works by causing a breakdown in the outer bacterial cell wall. Remember that? Well, human cells don't even have a cell wall. So therefore, penicillin has really almost no effect on human cells. It's only a problem if you're allergic to penicillin. If you're not allergic to penicillin, it has very minimal effect on our cells. While it causes bacterial cells, at least those that have an outer cell wall, to fall apart. So that's the difference. Anti-inflammatory drugs are drugs that reduce general inflammation, redness, swelling, pain, and so on. And we're going to talk more about anti-inflammatory drugs. There are two major categories of anti-inflammatory drugs. NSAIDs, remember what that is? Non-steroidal anti-inflammatory drugs such as ibuprofen and so on. And steroidal anti-inflammatory drugs such as prednisone, cortisone, Cordate. All right, so those are steroidal, which are more powerful. As far as local anesthetics, so again, you may apply an anesthetic topically, such as lidocaine, and an anesthetic, as we reviewed previously, doesn't just alleviate pain, it takes away all sensation. So when you have lidocaine, you don't have any feeling, any sensation. Okay, so those are some examples of drugs that are taken topically.